Dr. Sapna Sriram, and I'm a chiropractor, registered acupuncturist, and the CEO and co-founder of Integra Health Center. Initially kind of coming up with the concept of Integra Health Center, it goes back to when I decided to even do my MBA. I was always drawn by the concept of interprofessional collaboration. I felt that as an individual professional, it's really hard to have all the answers, and I was always frustrated by the healthcare system growing up to trying to find answers, and you go to one person and then, it's the siloed, fragmented, and disconnected service where you're trying to find answers, but nobody's talking together. And it really makes no sense when you really think about most other businesses. People talk, people engage, and it's a process. And I felt that that was really missing in healthcare. 10 years ago, I graduated from chiropractic school, and I decided to embark on a career in chiropractic. But it didn't stop there for me. I had a lot of passion and eagerness to sort of change the healthcare system. So while I started off in practice, I decided to do my master's in business. After I finished my MBA, a lot of people asked me, what do you want to do? And so I decided to start putting myself out there and do some marketing. So I decided to create a website and just create a good educational platform, because I felt that at that time there was a lot of missing content from, practitioners out there that could just, give their knowledge out to the community outside the confines of their four walls. So from there, I never really looked back. My exposure online just grew, my followers grew, and I started doing a lot of educational work outside of my clinic. And the more and more I started to work within a multidisciplinary setting, I realized that there was a huge missing gap in healthcare, and mostly of that being a integrated model to really help patients, meet all their healthcare needs under one roof. To be seeing so many patients these days with anxiety, with issues with their digestive systems, issues with their, musculoskeletal systems, everything is connected. And I think when you look at the high-paced world that we live in, things are always coming on us. There's so much pressure. There's no specific, one-size-fits-all. Every patient these days that comes in our door has multiple issues. And I think that's one of the things that we've been realizing, or I've been able to realize in the last 10 years of my career, is that, you can help work with someone on one issue, but it's, there's other issues underlying. And again, when you realize that you don't have all the tools to help them in your own toolkit, but you have the resources as a team to really come together and deliver that patient-centered care, that's when magic happens. We didn't want it to feel like you were going into a typical sterile doctor's office. We wanted it to feel like you were in a warm environment that didn't feel medical. So when we thought about that as well, we realized we're going to need a more private space, and we're going to need something that's also large enough to house as many services as we do. And because we have a lot of private services and medical services, and we also have some services that are a bit sensitive, not everyone wants to know if you're getting cosmetic medicine done, or not everyone may want to know that you're seeing a mental health counselor. So we wanted to keep that privacy factor in mind as well. And so I think education is so paramount for us to finally get it as a community. I think, we talk a lot about health. We talk a lot about taking ownership and accountability to lead a healthy lifestyle. But what does that really mean? Having grassroots initiatives from a really young age, so that, the school systems are putting into place a proper educational component on how to manage your health mentally, how to manage your health physically, how to manage your health emotionally. I think all of those things are so important, and I think by giving students and giving children, or anybody from a younger age, that toolkit to really help them navigate through their body, through their feelings, and everything else that they might encounter down the road, will give them better ability to utilize the services that they're going to need. Because it is so common, even till today, when you have someone coming in thinking they need to see someone for a quick medication or prescription for, say, a headache, when really they could try an allied health professional who can get rid of their headache naturally within minutes, and then go through a series of different preventative approaches so they don't keep getting headaches, versus focusing on just a pharmaceutical option. And having the resources and the education available for them is what can really help them get well and transform their lives, so that they're not constantly doing the bad habits that they're doing to themselves over and over and over again.